Are you struggling with keeping your students engaged in the classroom? Well, you're not alone. I want you to think about right now, what type of teaching strategy did your faculty use when you were in nursing school? Maybe it was 5 years ago, maybe it was 30 years ago, but whatever time frame that was for you, write down right now, what are two teaching strategies that you remember your faculty using? Okay, and right now we're playing music intentionally because we know that music kind of shifts the energy and also can increase engagement in the classroom. Just like with technology, we have to use it appropriately. Okay, so if you haven't already, go ahead and print out your study worksheet. And on that study worksheet, you can go ahead and write down what those two teaching strategies are that you remember most from your student experience. All right, so I'll tell you mine. The one that I remember the most is actually lectures with low lighting and the overhead projector. How many of us remember that overhead projector? Yes, even to this day, I say that's the reason why I needed glasses, is because those low lights definitely strained my eyes. And by the time I was 19, I needed glasses. Now, when I left high school, I had 20/20 vision. So that's the impact that our teaching strategies can have on our students. It can not only affect their vision, but it can affect their ability to focus and really connect with the content that we have designed to help them learn. That is our goal when we are planning out what we're going to teach and how we're going to facilitate that learning process. We want to consider, what are the engaging strategies that I'm using, those high impact active learning strategies that I'm using with my students. All right, so welcome back, everybody. If you haven't joined us before, we're delighted that you all are here. I am Dr. Sellers with Dr. Sellers Educate, and our mission, our number one mission, is to support all nurse educator colleagues on the journey to achieve certification. For some of you, that may be CNE. For some of you, that may be CHESI or other certifications, especially if you are a clinical educator. What we want you to think about, first of all, when you print out your study worksheet, is what is your objective? Okay, you can see right here, you're writing down today's date as well as the objective, because we want you to feel like you have accomplished something based on the time that you have spent with us. We know your time is very valuable. We know that time is our number one asset, because once it's gone, we can't replace that time. Okay, so we want to maximize the time that you're spending here on this snapshot to be laser focused on content that is going to help you achieve success. All right, so the second step we want you to take is to pull out your resource. Okay, so Billings and Halstead is the primary resource that we use on our journey to achieve nurse educator excellence. If you're on the journey to CNE, I'll go ahead and tell you that competency 2 is most aligned with the content that we're discussing today. But of course, when you look at all of the competencies, especially competencies 5 through 8, we know that's laser focused on our ability to really invest in ourselves, to equip ourselves with some of those evidence-based practices that will help us perform better in our learning experiences that we're developing, and also help us be better engaged in how we are developing our skills. Okay, so let me say that again. Competencies 5 through 8 really do focus on our ability to invest in ourselves, to advance our development, and to become a better nurse educator. Okay, so competency 1 through 4 is all about, how do I facilitate learning? How do I develop curriculum? How do I evaluate and validate the learning has happened? And then for CNE, competencies 5 and 8 really take that deeper dive into looking at the reflective process so that we can become a better nurse educator tomorrow than we were today. All right, and we're going to change it up. We're going to take a look at our resources that you're going to be focusing on. Primarily is chapter 2, okay? And so I'm not going to spill it right now. I'm going to go ahead and transition over to our thought-provoking question. And then we'll come back and talk about specific page numbers and why chapter 2 is so critical as you think about your journey and closing your knowledge gaps related to mistake number 11. I know, I can't believe we're already at mistake number 11. If you haven't already, you want to go ahead and pull out your PDF document. Okay, that PDF document is going to allow you to look at the process and the journey that we've gone on through our experiences in exploring our well, actually it's 12 mistakes, but we're on number 11 today. All right, so that's what we want you to do, is really to reflect on those mistakes, and most importantly, how are you going to overcome those mistakes? So let's take a look at number 11. So not adapting to diverse learning needs. So here's the mistake. Failing to recognize and accommodate the varied learning styles and needs of students can result in disengagement and hindered academic performance. I don't know about you, but I spend quite a bit of time developing my content. Even though I teach online at the graduate level, I still spend time reviewing the content, looking at the literature, citing references, engaging in discussions with my online learners because I want to role model academic excellence and hopefully supporting our future nurse educators as well as our current nurse educators and leaders to improve their competency and their ability to implement evidence-based strategies that are going to help their growth, right? To help them develop their skills. That's our goal, whether we're teaching at the graduate level or undergraduate levels. We want to make sure that we're investing in ourselves first. And then second of all, that that's transferring over into the learning experiences that we are ultimately facilitating for our students. Okay, so let's go back to the actual document. And what I want you to do is really think about kind of where you are today and what you need to work on to take you to that next level. So here's a solution. We want to assess our students' learning styles and adapt our teaching methods accordingly, incorporating a variety of instructional strategies such as visual aids, hands-on activities, and group work to meet the diverse needs of your students. And there is a supplemental video that will help you really dig into some of these concepts. All right, so empowering your students to not only succeed in their careers, but to lead in transforming the future of healthcare, right? That is our goal. We ultimately want to empower our students to become better at whatever focus is for our class, to become better as it relates to administration of medications, to become better with their health assessment skills, to become better at understanding nursing theory and knowing how to bridge that theory practice gap. Okay, so let's take a look at our thought-provoking question and see what you all think about this. So we have Dr. Taylor, who notices a wide range of abilities in their pharmacology class, but continues to use the same lecture format for all students. What teaching strategy can best address diverse learning needs? All right, so we have three options. A is incorporate a mix of visual simulations and discussions to engage all learners. B, ask students to complete the Learning Styles Inventory tool and assign reading assignments since most students are visual learners. Or C, use only standardized tests for evaluation to ensure consistent evaluation of learning. All right, so what you want to think about is, what is this question really asking me? And what is it that I know for sure about content that is included in this question? When you get to the C&E exam, you may get to a point where you're thinking, there's two really good answers. And I'm struggling with figuring out which specific answer is the best answer. This is what we want you to do. When you find that you're struggling to decide between the last two, we want you to reflect on two things. First of all, think about your actual teaching experience. Okay, so how do you integrate whatever that question is related to? How do you integrate evidence-based practice into your teaching experience with your students based on that specific concept? Okay, and then the second consideration we want you to think about is skipping that question. Okay, so if you get it down to two and you can't decipher which one is the correct answer, but you're able to align it with your evidence-based practice, you can make a note and move on to the next question. And this is why. Sometimes you just get stuck. Sometimes that we have a lapse in memory about concepts when we get to the C&E exam, right? Especially if we have high levels of anxiety. And that's okay. Remember that you have 150 questions on the exam. You have 3 hours to take the exam, and we want you to use those 3 hours. Okay, so you have to govern yourself accordingly. But if you get down to two and you can't figure out which one is correct, make a note on what you know you've integrated as part of your teaching strategy that's evidence-based. Okay, so you already know what the Billings and Halstead textbook said about that teaching strategy. but maybe you just cannot figure out which one is the correct answer. Okay, you're going to skip it, you're going to write down a note, and then you're going to go back to that specific question, pacing yourself, knowing that you only have 3 hours for the exam. All right, so now let's go back and take a look at our content while you all are thinking about what the best answer is for that question. Hopefully, you've been able to write down which one is the correct one. And just stay with us to the end. We always go back and reflect on that thought-provoking question to make sure that we're all on the same page. So we're going to talk about the rationale for the correct answer and the incorrect answer. And that's what we want you to remember. Even though we get excited when you choose the correct answer, that's great, right? Everybody gets excited about that. It's most important that you understand the rationale. So why is that specific answer correct? And why are the other 2 options not correct? All of the exams now have 3 options, okay? So we want you to be well prepared with the exam format and to think about what the best answers are, because often there will be 2 really good answers. Diverse learning, that's what we're talking about in this snapshot. It's important that we understand what our students' learning needs are today based on the diversity of our students that are sitting in the seat, either virtually or in person or in the clinical setting, and the impact that that can have. All right, so let's go ahead and take a look at what our focal areas should be as it relates to diversity. So first, it's most aligned with competency 2, and you want to consider, what are my students' different learning styles? Consider this question. What steps can you take to ensure your teaching methods address diverse learning preferences? Okay, we saw in that thought-provoking question, there was a mention of learning styles inventory. How is that incorporated in your learning experiences that you develop for your students? First, you want to consider what the biggest challenge is when it comes to our learning experiences that we're developing for our students. All right, so let's take a look at our actual textbook, okay, that gives us a lot of information about exactly that. All right, so chapter 2, Billings and Halstead. So let's talk about some of those barriers, right? Before we dig deep into strategies that we want to focus on, let's talk about who's in the room. That is exactly what the Learning Styles Inventory helps us to do. Not only does it help us know who's in the room, but it also helps students better understand how they learn. And we don't want them to only learn 2 different ways, right? Let's just say that's what their LSI says, that maybe they're auditory and they're visual. Well, that's good for the student to know, but what we want to do is to really challenge them to extend their learning across all 4 different learning styles. All right, so let's take a look on page 22 in Billings and Halstead. We want to consider specific characteristics of students because that's going to help us align the best teaching strategies to engage our students on the learning journey. Okay, so number 1 barrier that's mentioned on page 23 is the lack of financial resources. Number 2, the lack of rigorous academic preparation. Oh, this is a good one. Think about the pandemic. Even with inclement weather, even with changes in condition, whether that's wildfires, there's so many changes that's out of our control that can really shift the type of learning that our students are exposed to. So oftentimes students are switched to the remote learning instead of the in-person for our K through 12. We know the evidence says that there has been significant learning loss when it comes to that student population. And then they come to college and we wonder why they're challenged with reading a textbook, or they're challenged with staying awake, staying engaged in the classroom, working well with others. We know during the pandemic, there was significant social isolation. So sometimes our students struggle with really acclimating to group work and figuring out how to work well together. So we should give them evidence-based practices to help them, to guide them through that process. All right, so that's a really good one on page 23. Social class differences and academic success. We know that financial means does give us all access to additional resources. It's no different in academia, okay? So that's what you want to consider. Next is lack of language skills. English as an additional language, it is now called EAL. The fact that many studies of EAL have examined Hispanic, Asian, and American Indian students, but ignored other significant immigrant population. Several studies, listen to this, have found that EAL students experience several barriers, such as lack of self-confidence. Many of them are first-generation college students. Second, reading, writing, and learning difficulties. How many of our students are not of a European or white descent in our classroom? And just think about all of these challenges that are listed here on page 23. Reading and writing learning difficulties, like we said, isolation, prejudice, perceived inferiority, and stereotyping. And that is quoted from or included as a citation from Starkey in 2015. Okay, so let's talk about others. Lack of faculty diversity. I want you to go ahead and write down as I'm talking through these, the specific ones that resonate with you or that show up in your learning experience within your nursing program. And then it lists out strategies to increase the success of diverse students. Okay, so admission process, so taking a deep dive and looking at your admission process. And you may wonder, why is that important? Well, I want to point out that it is important to acknowledge that many nursing programs rely on standardized tests and GPAs in their admission decision. Now, the research doesn't say that we should not rely on some of those tools. However, the shift really is looking at the holistic admission process because of some of the barriers that I just talked about. Again, we know that resources, financial resources, give us more access to support that we may need. And so those students that don't have the financial means or resources may not have the same level of access. Okay, so go ahead and take a look on page 25 as well through 27, and that's going to give you some really good content to help you close your knowledge gaps related to these concepts. All right, so let's sum up our last few slides, and then we'll go back to our thought-provoking question. So again, I want you to think about those concepts that we just talked about and which one of those show up in your nursing program or even in your classroom. And then you want to consider these steps that we're going to talk about to help you overcome those challenges, those opportunities when it comes to the diverse learner. Okay, so the Learning Styles Inventory tool is one of those. And the influence that it can have is that it can lead to frustration and underachievement. Just think about the diversity of our English as additional language students that I just talked about, right? And think about how they start out at -10, right? So they're not level, they're not at ground zero like the other students. They adversities that we talked about, right? That we just listed. So what do we want to do? We want to consider adapting our learning experiences that we are developing for our students. Some strategies that we can use. Number one, incorporated those varied teaching methods. What is that going to look like? Creating flexible learning environments for all students, looking at the group work that's happening in this video, engaging with our students about peer-to-peer learning and other active learning strategies that are going to help them not only learn from us as the facilitator, but also learn from each other. Encouraging collaborative learning environments. We want to foster teamwork. Now, not only does this help our students in the classroom, but we know it also helps our nursing students perform better in the clinical setting, the skills lab setting, as well as in the simulation setting. Fostering growth for an inclusive teaching experience for our students not only yields positive outcomes for those students that may be predispositioned to having some of the challenges that we talked about, but it is growth for all of our students, right? It helps all students, not only those diverse learners, but also our students that may have a more broad way of learning, right? Maybe they learn in all 4 different ways, which is a great skill set to have. When we think about our 4 different types of learners, we know that VARC is an acronym that's associated with that. So visual, auditory, the learner that really enjoys reading, and kinesthetic. So for the visual learner, we want to think about how am I incorporating visual aids, just like you all see this PowerPoint presentation. Now, clearly, this is not something that we have to have, but we know lots of colleagues are visual learners. We also know colleagues are auditory learners. So what do? We have recorded content, and to support the auditory, we have the visual, and then the kinesthetic. What did we mention earlier? Pulling out your study worksheet, right? So hopefully you all have the study worksheet. I know that you may be multitasking, and that's okay. But ideally, If you are watching and engaging in our conversation in the snapshot, we are going to connect with all four different types of learners, right? We even went to our textbook, and what did I do? I read it out loud. I read some of those sections to connect the evidence-based content with the actual discussion that we're having today. Step one, as we looked at earlier, is really understanding what are those challenges, what are those difficulties that my students are experiencing. Education is only truly effective when it embraces the diverse learning needs of all of our students. Now, I realize sometimes we may not even know what those diverse needs are. So we want to take a proactive approach by considering the different types of learning that we can engage our students in. You can see the hands-on approach. You can see the visual approach. You can see that individual connectivity, right? That's through our office hours, or maybe that is even through some time that we have before or after class to huddle with our students to talk through muddy points. CNE Review on the Go app is another great example of how we engage with different types of learners. We know that your lives are busy. We also know that only 70% of nurse educator colleagues passed the CNE exam in 2024. And because our mission is to support all colleagues to be successful, we have adapted the style, the options that you have when it comes to studying the content so you can be fully equipped with the resource that you need to achieve success when you get to the CNE exam. So if that's you that's struggling with time, consider CNE Review on the Go app. You can easily subscribe to that. Email us if you have questions, or you can go to our website and you'll also find an overview, a link to an overview of what you can expect with the CNE on the Go app. Adapting to learning needs. There are three essential categories. First is understanding the student's background, okay? And then second of all, we want to integrate technology that is going to be identified as a tool to help our students. And then we want to encourage that collaboration. We certainly want to take a proactive approach and give our students resources to help them work more collaboratively. But let's go ahead and have a conversation with students at the beginning of our courses so they understand why group work is so important, and giving them tips to help them maneuver through some of the challenges that are frequently associated with group work. And then last, but certainly not least, are those flexible assessments. So we want to engage informative feedback with our students where we're giving them feedback along the way so they're not surprised when they get to the end and they do not perform well on that final exam. Okay, so hopefully our students are going to take steps and move forward with necessary interventions based on the feedback that we've given them on the formative assessment throughout the semester. And we know the negative association whenever they don't is that they don't perform well. Okay, so that is the outcome. But when we have done our part with the input on the front end to take a more collaborative approach on the learning journey to give more formative feedback to our students, then hopefully students will embrace that feedback, make adjustments, and perform well. Consider making a checklist. Okay, so we've just listed some of the elements related to diverse learning needs. How many of these are you checking off right now? You want to think about adding this, and you can take a screenshot of it. When you are reflecting on what worked well, what didn't work so well when it comes to the courses that you're teaching, how many of these have you checked off the list? And then next step is to think about what can you do differently, looking at chapter 2 to create a more inclusive learning experience. So what's your number? 1, do you feel lost based on the content we've reviewed? Or 5, you feel like you're ready to teach. So tell me what your number is. Go ahead and put that in the comment section. Okay, we do go back and review our comments if you're not watching this live. So tell us how you're feeling about content that we just covered. And we hope that you're tuning in every single week. Go ahead and subscribe and click the bell so you'll be notified every single time a new snapshot is released, which usually happens every week. Okay, and you can go to our website to find out information about all the resources that we offer. And if you need a resource and you don't see it, just email us, info@drssellerseducate.com. All right, so are you all ready? You ready to go back to our thought-provoking question? All right, so hopefully everybody's had a chance to write it down. If you chose A, you are correct. So give yourself a round of applause if you chose A. The reason why A is correct is because we are engaging in what is called multimodal teaching, right? When we engage with visuals, simulations, and discussions. B is not correct because we're making an assumption. Okay, so first and foremost, reading is not necessarily associated with engaging the visual learner. It may or may not, but if students have a deficiency or a challenge with reading, but they're visual, then we can't make an assumption that reading assignment is going to connect with our visual learners, right? It will with our reading students, right? Those students that learn best through reading. And then C, that's incorrect because we are limiting students' evaluation and really our ability to validate that learning has happened when we only use standardized tests. Okay, so think about what we mentioned earlier about standardized tests on pages 22 through 27 in the 6th edition is going to identify in more detail than what we've covered in this snapshot exactly why we don't want to only use standardized tests when we are making admission decisions and when we are validating whether or not learning has happened, offering a variety of assessment strategies. Okay, so we, yes, have to use standardized tests to really measure the learning and to get students more comfortable with those type of tests, but we don't want to limit it to the only type of evaluation that we use. All right, so this is what we want you to do. We want you to pause. We want you to reflect on what attracted you to the incorrect option. And then we want you to act. Okay, so we want you to read chapter 2 in Billings and Halstead, the 6th edition. Okay, so chapter 2 to help you close your knowledge gaps. Remember that we are here to support you on your journey until you are successful, no matter how long that takes. The only way you will not achieve success on the C&E exam is if you quit. We look forward to seeing you in our next snapshot. Have a great one, everybody.